Let's talk more about the CIMT. So somebody's getting an ultrasound done in the neck. We're looking at the carotid arteries there. How much does that correlate to what's happening in the heart?
It's a great question, and it depends on how you do it. So I will start off by saying, in the general medical community, CIMT is not well liked. It is not recommended, and many classic providers will not do it. If the average person is getting an ultrasound of their carotid arteries, what they're usually getting is a standard regular carotid duplex, which is looking for enough plaque to narrow the artery by 50% or more, which is a lot of plaque if you're thinking about, the grand scheme of things. Below 50%, a regular carotid duplex is going to read as normal. Some techs will comment on the presence of soft plaque or any plaque that is not flow limiting, but not every tech will. And not every physician who reads that ultrasound will make any mention of plaque if it's less than 50% narrowed. So that's what the average person gets when you get an ultrasound of the neck. That's not super helpful in understanding your coronary risk if it's negative. The CIMT is, if you just say it like that, right, just a CIMT, that is a measurement that any ultrasound machine can do with the push of a button. And by that standard, it's not super helpful. What it really means is the thickness of the two innermost layers of the artery wall. It's the intima and the media. That's the I and the M in the CIMT. That measurement, if you're only looking at one small piece of a three-dimensional structure, is not super reliable. The IMT measurement is a little bit dependent on the sonographer who's doing the testing and where they're choosing to get that measurement. The way to make this a much more reliable examination is to have a protocol where we're taking multiple images at very high resolution of the common carotid artery on both sides of the neck. We're trying to take pictures of the entire back wall of the artery, so that requires multiple different angles of the probe to get that, and then making as many measurements as we can, hundreds of measurements on each of these images, and averaging that to try to get a very precise estimate of that IMT. And if we're doing a true IMT high-quality protocol test, we are also looking for the presence of plaque, which is a separate part of this examination. When I think about CIMT in my practice, this is really what I mean, is also the detection of plaque. And there is a very well-known preventive cardiologist named Dr. Fusser who has done work imaging middle-aged asymptomatic individuals, and between detecting plaque in the carotid arteries in the neck and the femoral arteries in the leg, we can get about 90% concordance with coronary imaging. So that means 10% of the time we're missing patients. Either they have plaque in the neck and the femorals but don't have it in the heart, or they have it in the heart and we didn't detect anything from the neck and the groin area. But 90% isn't bad considering we're having no radiation. It's a test we could do every year, and it is, pretty reliable.
Okay, it sounds like there's a real art to getting this done properly and getting the value from it. How does somebody find a practitioner who's competent at doing it?
I think the best thing to do is to go through there's at least one amazing lab. So CardioRisk is the imaging lab that I use to grade and score my IMT tests. There may be some others out there, but in my research, I haven't found any of them as dedicated to quality, reliability, and reproducibility as the CardioRisk team. So CardioRisk is a company. I send them my ultrasound images, but they have ultrasound techs of their own, and they will fly a tech out to your practice. If you're a clinician and you have 10 people who you need to get scanned, if you can get them all together in a day, CardioRisk will send a sonographer and an ultrasound out to your practice, and they will scan those patients for you. They are now doing some pop-up scans. So if you go to the cardiorisk.com website and you look up where can I get scanned, they are now having these pop-up events where they have 1 or 2 days a month in California, Arizona, Hawaii, other places around the country where anybody can sign up and go get a scan. So CardioRisk is still a small company. There are not, again, this is why I still use calcium scoring for some patients, because not everybody can get a CardioRisk CIMT done. But if you can, that is far and away the best test.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
I, as a vascular surgeon, predominantly see people who've had a problem already from plaque. Why do you have plaque? Is this an inflammation problem? Is this a lipid problem? An insulin problem? Where is it?